Hi FGTN members, I welcome you all to FGTN television. I am Kimaru and I present Maternal Child Health. Today our subject will be preconception. Last time I told you I'll do preconception, conception, antenatal care, labor and delivery, postnatal care, family planning, and vaccines that are given to our children as they grow up. Today, we are going to talk about preconception care. This is the idea or care given to a couple before they conceive. Today, we are going to see the different types of activities or examinations that are done to a couple when they visit the health facility near them. They are supposed, number one, to go to the nearest health facility to see a doctor or a nurse or a healthcare worker so that they will be able to be addressed accordingly. In the healthcare facility, they are supposed to be taken history. History means we want to know more about this couple in both sides, the side of the lady and the side of the gentleman. Is there anybody in their family who has ever had diseases like hypertension, diabetes, tuberculosis, or mental health, or any other disease that is chronic? And if there is any, it has to be treated before they conceive. The other issue is the doctor or the nurse or the healthcare worker will be able to do physical assessment. In physical assessment, we start by doing head to toe examination. From head to toe, it means the healthcare worker will go one by one, checking whether there is any abnormality or anything that is abnormal, so that these guys are given the right care. Then from there, the other history that needs to be taken, it is this lady, has she ever had pregnancy before? And if so, when? Did it reach term? Did she give a birth to a baby? Was that baby alive or dead before it was born, or stillbirth? So it is very important to take history of it is called the obstetric history. Then there are other history that need to be taken, the present history. They are asked what has brought them to the clinic. They must give that history to the healthcare worker so that he or she is able to organize them all, see what he or she can do to them. The other thing is that these people, they are going to be advised on different types of food they are supposed to eat. And about the food is very important, because you need energy, giving foods like proteins. We need foods that are rich in vitamins, all the types of vitamins, food that are bodybuilding foods, and you know them. We have the proteins, we have the beans, we have all the types of beans. And before you address this couple, you must take the history, the financial history. Where do they get money from? So you take history so that when you're addressing them, you'll know whether they will afford the food you have prescribed to them or not. So the different types of foods, when we start from the proteins, these are bodybuilding foods and they are very expensive. So bodybuilding foods, you have seen an example, there's meat, there's beans, legumes, and it's very important to know whether they have money to purchase the food or not. The other foods are carbohydrates. You get carbohydrates from maize, beans, sorghum, all those. They will give you energy so that you can be able to perform your activities right. The other one is vitamins. Vitamins are very important, especially citrus fruits. They advise couples who want to become pregnant to eat citrus fruits because they have effect on the hormones. And you know the hormones are in women, they are very important because they enable the ovary to produce ova that will go through the fallopian tubes up to the uterus to be fertilized. And on the side of men, these citrus fruits, they assist the sperm to propel sperms from wherever they are produced up to where this sperm will meet the ova for fertilization. After the fertilization has taken place, the fertilized ova move down up to the uterus, the endometrium, where they attach or embed that fertilized ovum. It attaches itself in the inner part of the endometrium and it starts growing from there. So it is very important to know all this, the importance of citrus fruits. Then this couple is also supposed to eat foods that are rich in vitamins again, like the spinach, green leafy vegetables like spinach, skuma, and even cabbages. So then after that, they are supposed to take a lot of water, 80 glasses of water according to WHO per day, so that they may dehydrate themselves, not to become dehydrated, for the sake of the fetus that is growing in the uterus. Then from there, they are supposed to also to do exercises. Exercises are very important so that they are able to be fit physically, because health, it is according to WHO a state of complete physical, social, and even and spiritual, not merely absence of diseases or infirmities. So when they do the exercises, they will keep fit and they will be on the right track. So it is very, very important to do all those things before they conceive. Then from immediately they know they have conceived, they are supposed to go to the antenatal clinic. But in the antenatal clinic, they will be able to be given folic acid. Folic acid, 40 milligrams per day, is very important because it will assist to form the growing fetus, not to have deformities, especially the deformities of the spinal cord. The growing fetus would get the spina bifida, which is an abnormality. So it is also very important to get ferrous and vitamin A. Vitamin A is also very important. It will assist this mother to boost her immunity for the sake of the baby. When you want to have food that is rich in vitamin A, you eat all those, the fruits or the orange things, or the pawpaw, the tomato, the carrots, those which are orange. They have vitamin A, which is very rich. They have vitamin A that is very important to boost the immunity of this mother, and also it assists in sight, you seeing properly. The other thing is water and minerals. We have minerals, we have phosphorus, we the potassium. Potassium, you can get potassium from bananas, ripe bananas. You can also, we have zinc. All those minerals, they are very important for the baby, the growing fetus, and the mother. Then we have said the exercises, they are very important. and attending antenatal. Immediately you know you are pregnant, make sure you attend antenatal clinic so that you can be taken care of. In the antenatal clinic, you'll get vaccines like tetanus toxoid, which assists the mother not to get tetanus when they, for example, if they deliver at home or they deliver when going to the facility. There is risk of getting infection. So if they get that tetanus toxoid vaccine, they will be able to prevent those infections of the mother and the newborn baby. Therefore, in the antenatal clinic, they will also be checked their hemoglobin level. If it is low, it will be addressed accordingly, so that when they go to deliver in the hospital, they won't go to the hospital with low hemoglobin level. Majority of people or mothers who have low hemoglobin level, when they go to deliver, they get postpartum hemorrhage. So the blood that is low, it comes out, and these mothers die because of hemorrhage. Majority of our mothers are dying because of hemorrhage. That is excessive bleeding after birth. So this has to be prevented. So when we are addressing our mothers, we should address them to deliver in a facility whereby, in case of anything, these mothers can be taken care of by qualified midwives and doctors. Therefore, during antenatal period, we address mothers to deliver in facilities, and even birth plan. During antenatal period, these mothers are dressed on where to deliver. That's why we say birth plan. You can book for the taxi that will take you to the facility during the day of labor. You can plan for the midwife or the woman who will take you to the hospital with your husband. You can plan for the clothes for the newborn baby, the laces, the clothes for the newborn baby. You plan them and put them in a bag, so that when it comes to labor, you would send people to go and buy clothes after the baby is born because of the cold. So it is very important to address these mothers on what to do during the antenatal period. You tell them the importance of attending antenatal period until term. Then after delivery, advise them properly on family planning, because these mothers can become pregnant even before 2 months are over. So you address them to come for the antenatal clinic immediately after, to come for postnatal clinic, so they can get a family planning method before it is too late. The other one is the care of the baby. Address these mothers to take their children for the immunizations and vaccines up to 5 years, so that these babies can be prevented from getting diseases that are preventable. Therefore, today we are going to stop there. I'm so proud for you FGTN members for listening to me. Until the time we shall meet again. Bye.
In a world connected by dreams and aspirations, how do we bridge the distances between us? At Fulbright Theological Seminary, we believe the answer begins with a shared vision. We are a global community, bringing together voices from every country, students and leaders, all united in a single purpose. Our mission is to provide theological excellence without borders, combining timeless wisdom with modern innovation. Imagine joining a vibrant classroom from anywhere in the world, connecting with brilliant minds and dedicated men. Here, faith is put into action. We are equipping a new generation of leaders to inspire, to serve, and to transform their communities and nations. This is more than just an education. It's a calling to make a global impact. Fulbright Theological Seminary, reaching the world, shaping tomorrow's leaders. Join